Hi, my name is Stephanie Kinman and I'm a registered nurse here at Johnson Memorial Hospital, and I would like to talk to you today about transition of care programs. Trials have been completed on transition of care programs in some specific hospitals in Philadelphia. These trials have shown that with the transition of care program in place, hospital readmissions were reduced by 30 to 50% over 5 to 12 months. And also, healthcare costs were reduced of those in the program by $4,000 over the 5 to 12 months. Now, you can find all that information on evidencebasedprograms.org under traditional care model. That study was done in 2010. Now just think about that. With this transition of care program in place, hospital readmissions were reduced by 30 to 50%. Those are some big numbers. Research suggests that implementing a transition of care program in the hospital setting will help reduce hospital costs, and the way you do that is the program will help increase patient independence and also reduce hospital readmissions. So the main points I want to talk to you today is about the transition of care program can help increase patient independence and help reduce the hospital readmissions. Now let me explain to you a little bit about what a transition of care program is. A transition of care program helps a patient move from the hospital back to home smoothly. And the way they do that is a nurse will come in while the patient is still at the hospital and talk to the patient about their chronic disease and also about their new medications, and just kind of grasp how much knowledge the patient has about those. And once the patient is discharged from the hospital, that same nurse will call that patient and also will go out to the patient's home and visit that patient. And so it's a continuum of care there with the same nurse, and then that patient will also have that nurse's number in case they have any questions or are having symptoms and they need some help with it. The program will empower the inpatient by increasing patient knowledge of chronic illness and medications. Now this is under our first point of increasing patient independence. So help empower the patient by increasing the knowledge of their chronic illness and medications, and also will help increase the patient's overall health. And you can find more information on that at the Traditional Care Info website under Patients and Family Caregivers. That was done in 2014. That the patient will increase independence because the nurse is helping them learn their medications. The nurse is making sure they have a safe environment. And so that's going to increase the patient independence because they know about their chronic illness and they know what steps they need to take. They know about their medications that they're taking. The overall health of the patient is increased, and that means less visits to the emergency room. And also that means less healthcare costs for the patient and also for the hospital. So that was increasing patient independence. I kind of want to move into, now we're going to talk about how to reduce hospital readmissions. The program will help reduce hospital readmissions by having the patient become their own advocate in healthcare. This kind of works along with having the patient having independence. Now they're going to be their own advocate in healthcare. And so they know about their chronic illnesses, and so they know what steps they need to take. So instead of going to the emergency room, they go to the primary care physician instead. So that'll help reduce some of the hospital readmissions. Also, under reducing hospital readmissions, in trials of a transition care program, the program showed to reduce hospital readmissions by 30 to 50%. I mentioned this earlier. So if they're in the program, the chance of them coming back to the hospital is reduced by 30 to 50%. And I want to show you a visual of this. This study was done by Dr. Naylor, and it was actually a presentation she did in 2011, and they just did some readjusting to it in 2014. You can see here that her control group had 23% hospital readmission in 6 weeks. and the people that were in the transition of care program had hospital readmissions in 6 weeks of 10%. Now that is decreasing hospital readmissions by more than 50% when they were in the program. This is significant because Medicare and Medicaid will pay none or very little of the bill of a patient that has been readmitted to the hospital within 30 days of discharge. You can find this information on Readmissions Reduction Program on the Centers of Medicare and Medicaid Services website. That was done in 2014. So that's why this is so important for reducing hospital costs, because the hospital's not going to get reimbursed if this patient is readmitted to the hospital within 30 days. Now, what I said earlier, research suggests that implementing a transition of care program in the hospital will help reduce hospital costs because the program will increase the patient independence and help reduce hospital readmissions. So we got patient independence, and we also have reducing hospital readmissions in order for those are results of this transition of care program. As hospital personnel, we have the influence to be able to help the patients with their chronic illnesses take control of their lives and the opportunity to help reduce hospital costs, which in turn can then help with better staffing ratios, bonuses for hospital personnel, pay raises, and also better equipment and ultimately happier patients, which to me all around sounds like a win-win for the transition of care programs. Now, if you guys have any questions for me, you can come up to me after the presentation and ask me about anything about the transition of care programs. And also on this video, I attached a reference list if you want to learn more about it. Thank you.